My name is Peyton Walker,
And my name is Angel Barber.
and our project is over Chagas disease or trypanosomiasis. Trypanosomiasis is characterized by the infectious protozoa Trypanosoma cruzi, which is found in poor regions like South America and Mexico. And it's characterized by three phases: acute, indeterminate, and chronic. The chronic phase can be diagnosed using serological tests. The acute phase can be diagnosed using stained blood specimens, and the acute and indeterminate phases can both go unnoticed, but the chronic phase will present itself 10 to 40 years after infection. Trypanosoma cruzi is a parasitic euglenoid that feeds on the blood and lymph of its host. They can be found in the feces of infected bugs and contaminated food and beverages. And under the microscope, they're about the size of a red blood cell. The mode of transmission for this parasite is the kissing bug, and it contains the parasite T. cruzi in its feces. And when you scratch the bug bite or consume food or beverages with the contaminated bug inside, you can become infected, and it also can be transmitted through blood transfusion, organ transplants, and in utero from the mother to the child. And then to the right of me is the life cycle for the parasite, and essentially it gets into your system when the kissing bug takes the blood meal from an infected person, and then it bites you, and then you become infected, and it goes through its life cycle inside of you and inside of the muscles in your body that it infects. And then it's picked up again by another parasite and starts all over again.
The signs and symptoms of the disease are fever, severe headaches, loss of appetite, body aches, eyelid swelling, difficulty swallowing due to enlarged esophagus, abdominal pain or constipation due to enlarged colon, enlarged liver or spleen, swollen lymph nodes, and rash. The systems affected by T. cruzi. The autonomic nerve of the gastrointestinal tract and heart. During the chronic phase, the parasites are hidden in the heart and digestive muscles. In later years, the infections can lead to sudden death due to arrhythmias or progressive heart failure caused by destruction of the heart muscle in its nervous system. These parasites can also cause damage to the cardiac conduction systems. The lymphatic systems is also impacted by the T. cruzi infections, which causes swollen lymph nodes and spleen enlargements due to the inflammatory response of this system. The long-term and short-term problems caused are the short-term acute phase lasts for weeks or months, usually asymptomatic, happens soon after infection. When symptoms do occur, they go away after 3 to 8 weeks. If they're left untreated in some, it may advance to the chronic phase. The milder symptoms may occur at this phase, such as fever, loss of appetite, and body aches. The long-term chronic phase may occur 10 to 20 years after initial infection. It can lead to irregular heartbeat, congestive heart failure, and sudden cardiac arrest.
The treatment and prevention for this parasite is intratrypanosomal drugs like benznidazole or nifurtimox. I'm not sure if I'm saying that part right. They're effective drug treatments for acute infection, but the first one that I mentioned is favored because it's better tolerated in patients. They can be used in children and adults, and they can be used for the acute, chronic, early congenital, and reactivated infections. And prevention, insects, food, water precautions should be taken in order to avoid infection. Mud and adobe houses, which are usually found in like poorer countries, if you live in one of these or you visit one of these, it's best to use like nets and pesticides to reduce the chance of infection. And screening blood and organs for the disease can prevent the possibility of infection from blood transfusion or transplantation. And that's all.
We hope you enjoyed our presentation.